Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and all I perform is cosmetic or aesthetic plastic surgery. I perform lots and lots of fat transfer. I've been performing fat transfer for about 15 years now, and I think that I have a vast experience in that. A common question is fat transfer performed differently in men than women? So what are the needs of my male patients when they come in for fat transfer? The answer to the question is not really. Fat transfer is performed in the same technique as both men and women with different aesthetic objectives. So the technique itself, how one takes the fat, how one prepares it, and then how one re-injects it are generally the same. The difference is when, where, and how much. So I think the most important thing, as I said, is who is performing the fat transfer. Again, I've been doing it for over 15 years now. When I take it from a donor site, usually on men would be the abdomen or the flanks, I use a very, very small cannula with very low pressure. I will take that fat and atraumatically, I will concentrate that, get rid of the impurities, and then prepare that for re-injection. When I inject fat in the face on men, I use cannulas that are less than a millimeter in diameter. A very common area that I perform fat transfer would be beneath the eyes. In men would be along the midface. I also perform it along the jawline and cheekbones to provide some of that youthful fullness that we lose as we age. As opposed to women, I think in men, we want to make sure that we don't make it overly aesthetically obvious. So I'd like to be a little bit more subtle in men, but that doesn't mean they don't need specific amounts of volume. Again, the same technique is used, but generally in men versus women, we like to put it in differently in terms of where. Again, the most common areas for men would be beneath the eyes, along the cheekbones, and along the jawline. We like to instill some of that youthful volume that men lose along the bone structure, because that strong jawline and strong angular cheekbones are a sign of youth, and we like to give that back. Again, as men age, like women, we lose the volume beneath the eyes and start to look hollow. I re-inject it there. But specifically, the technique is the same. It's just the amount and where I do it is different. All in all, I like to make sure that that fat is handled atraumatically, that fat gains its own blood supply, and provides a long-lasting aesthetic result. If there needs to be a re-injection, it's usually performed in the office under local, and it's a very easy procedure. But the most common question and answer is, it depends upon who's performing it. I think you should see a plastic surgeon that performs a lot of fat transfer. Go on the internet, look at the before and afters, make sure that they have happy patients with regards to their recommendations online, and go in and talk to the plastic surgeon. Ask them how often they do it, ask to see some before and afters, and ask them how they will do it. So the best way is go in for consultation and come in anytime. Thank you.